Here we go.
Awesome.
Right. Well, here we are. Welcome. Thanks for your time, Oscar. Today we have
Thank you,
Dr.
Wes.
Wes and Dr. Oscar.
Hmm.
Just having a casual chat just to get to know Dr. Oscar a bit more and see what he has in mind in his brilliant mind of his. So tell us a little bit about yourself, Dr. Oscar, what you were doing before you started Chinese medicine.
All right, all right. Well, hello everyone. Thank you, Dr. West, for inviting me, and thank you everyone for watching this video. Prior to Chinese medicine, I spent a few time, I guess, soul searching. Spent some time working, doing different kinds of jobs, including hospitality. I've done some farm work before. I've done some very light admin work before. Music was a big thing that I used to follow. So I was a musician for many years.
What sort of music?
I was a percussionist and I was a disc jockey as well.
Wow.
The later one is the one I did probably from the age of around 13 to around 25 probably. And once I got into uni, and it got pretty hard, I had to stop music pretty much. And since then, uni's taken over, and I haven't gone back to music. I tell you that. So far, I'm planning to one day. Yeah.
How did you get, what made you get interested in traditional Chinese medicine?
Look up. I grew up in a house where my mom, she was a lot into Eastern philosophies.
Yeah.
So since I was a kid, I had access to books about Buddhism, about metaphysics, about Eastern philosophies, and I've always been very interested in what we are, and particularly the human mind. I actually went to study psychology when I finished high school, and I did a semester, but I wasn't modern psychology wasn't for me. I think I had already been. My mind was functioning in a more Eastern point of view. So I decided to take some time. I was 18 at the time and pursuing, spent some time trying to find what I wanted to do. And Eastern philosophies and health were always in my head. Mind you, I didn't know that Chinese medicine existed, right? Up until when I was like 20, 21, someone told me, why don't you study Chinese medicine? And everything just changed from there. And here I am ever since. Mm.
So how did you find the study of Chinese medicine and the course you went through?
I found that pretty challenging. The course, I think nobody actually expected it to be that hard, that complex. The course actually had a really big dropout rate. We started probably close to even 100 students. We finished only 18. And on the first semester, that's when a lot of people said, I wasn't expecting to have to learn so much, to have to memorize so much. So it was pretty full on. So the first semester was really challenging. And after that, it went smoother. I guess once you survive and you get used to it, it actually gets harder, but you just used to improving over time. The hardest aspect of it, which remains, for me as a practitioner, is that the knowledge of Chinese medicine is very abstract and conceptual. And it's not something that is easy to grasp. It's not direct modern knowledge like we use in our modern world. It's a completely way of seeing phenomena, seeing the human being. It has many advantages as you can use a very complete holistic model quite efficiently and well if you can manage the concepts. But learning the concepts and understanding them was really hard. And then applying them was harder.
What sort of subjects did you have to study at university?
Wow. There's heaps of things you have to learn. Look, for starters, the standard degree, I remember, was around 4 subjects a semester. We had to do 6 subjects per semester. Because my degree was a degree that was 5 years, but it was condensed into a double major in 4 years. So it became even more intense. We had a lot of subjects in Western medicine. In Australia, you demanded to know a lot of Western medicine to be able to practice another practice, which, this is Eastern medicine. So you have to do a lot of physiology, pathophysiology, pharmacology, anatomy. Going into the Eastern side of things, Chinese medicine is very complex. It divides in many areas to study. It has its own physiology, pathophysiology, some theoretical framework. When you do acupuncture, there's a lot of subjects involved, such as, point location, knowing about points, knowing meridians, knowing all the theory well. There are subjects where you get to learn how to needle each point, where you get to learn how to find points, how to diagnose through meridians. And it's the same with herbs. When you start with herbs, you learn herb by herb. And then you start learning formulas. And that's when herbs really start to make sense, when you see them put together. And that's usually the first 3 years. It's like the formation into a framework which can be applicable by then in your head. By the time you're in your 4th year, you're seeing more specialities. Chinese medicine divides in specialities like Western medicine. So standardly, we have to study pediatrics, gynecology, traumatology, dermatology, infectious diseases, and classics, from what I remember. There was a subject was called the School of Thoughts, which was more deeper into ancient classics. But when the course was restructured, it was taken off. But that's, I think, when they put all the classics together. That was probably one of the hardest subjects, right? Because you're working with texts that are written 2,000, 3,000 years ago from people that thought very differently. And you can see the way their minds work was very different. And now in the 21st century, you have to translate what they were saying, because that's still very useful info. That was uni-like. It was an intense trip, I tell you.
So if to someone who has no background or no knowledge of Chinese medicine, traditional Chinese medicine, how would you, who lives in a 21st century context, how would you explain how it works?
That's a really good question. I can tell you one thing. I don't think I have found the full answer for that. And instead of going into explaining how it works, it's easier to just touch on areas you're working with. For me, particularly, it's more with patients and talking about their health issues and explaining something more, maybe more modern terms about an Eastern term. It's really, really hard to explain Eastern abstract concepts straight. You can expect hardly anyone will understand you. So you'll have to use modern Western terminology. And over time, I guess you get used to it, to explain, I don't know, liver yin and liver yang in terms of liver circulation, in terms of methylation, or spleen yang in terms of digestive function, or but to give you a full idea of this is how it works, just like that, I haven't worked it out yet. Maybe one day. Yeah.
So what are the conditions that you see that are well treated by, and that you enjoy treating with traditional Chinese medicine?
Well, at the moment, most of my work focuses in chronic fatigue syndrome, chronic infections, a lot of gut problems, a lot of chronic inflammation overall, a lot of immunodeficiency states. I can tell you that Chinese medicine can give you good treatment for that, but that area is very particular in the sense that you need a lot of experience and knowledge, because it's like in China, that area is part of infectious diseases specialty. So it takes time to be able to be good at. If you ask me, like how would be how functional is Chinese medicine, how well it can treat things. my opinion from my experience is that it's able to treat practically most health conditions that I've seen, probably the majority of them, except for acute emergency situations that belong to an emergency department, you know. Although back in the day in China, Chinese medicine also had emergency medicine, but we don't use it anymore because we have also Western emergency medical support, right? But I have worked probably previously from working in integrative medicine. I worked in general practice for 5 years. And I've seen all kinds of areas: women's, kids, skin, mental health. I worked for 2 years in a psychiatric center. And I can tell you people responded well most of the time. But at the same time, I can tell you if it has to be a good practitioner to be able to work. The person needs to know what they're doing. So if you hear people saying, oh, look, I had Chinese medicine and that didn't work, it doesn't work, maybe the practitioner wasn't good enough, or even in Australia, even that we register, there's still a lot of people holding out as being Chinese medicine doctors, which are not, and it might be those stories when they fall into those hands. But I found it very effective for a lot of ailments, definitely.
So, like, how has your practice of Chinese medicine changed since you graduated from university?
Changed a lot. The first few years were pretty standard, very Chinese, very traditional Chinese medicine. You know, a lot of mainly pulse, tongue, all the diagnosis we have to do, palpation, and that was, you know, when I mean very Chinese medicine, what I would like to explain is that I work more into what I call integrative Chinese medicine, which is an area where we're integrating a lot of other ideas into the practice of Chinese medicine, including a lot of modern approaches. But back then, you know, before integrative medicine was just very Chinese medicine. It's hard to explain, you know, that because it has to be only Chinese medicine practitioner will understand, you know what I mean? It's just Chinese medicine. But let me explain it another way. When I started in integrative medicine, thanks to Dr. Taniash at Vitality Hub, it was a different game, right? I wasn't so used to a lot of modern approaches they use in integrative medicine. There was a lot of scientific testing involved, a lot of more outside of the ordinary scientific testing, a lot of different more holistic ideas were in a Western term, like how Western medicine, in more functional medicine, they see chronic inflammation. And so at the beginning, I had to kind of make a bridge in between them in terms to how I was gonna understand the modern aspect from a Chinese medicine point of view, and how I was going to understand Chinese medicine also from a modern point of view. And that's how I started making this bridge where I started to see things from both sides. And something which I have done consistently over time is to study a lot of Western medicine concepts. So over time, you start to see things through different lenses. And the difference between the lenses is the way they view things. Because after all, they're looking at the same thing, right? But they just have like different magnification or different, you know, size to them, you could say. So at the end, you know, up until now in my 11th year of practice now, I can tell you I practice very differently to when I started. I still use traditional Chinese medicine. That's the basis of all the diagnosis and treatment strategies at the end. But now, you know, people come with blood tests, come with stool tests. We can send for a stool test me or a blood test me directly. I send them to colleagues of mine like you, Western medical doctors, you know, for support. There's a lot of, you know, specialized tests like mineral testing involved. Physical examination in the Western world is amazing, what you can do with a stethoscope to check blood pressure. You can learn a lot by palpating someone and using modern technology. And at the end, you can translate everything through the glasses of Chinese medicine and give you a Chinese medicine point of view. I guess one thing I could say, by changing my practice to this mode, I have improved a lot the diagnostic and treatment framework over time. So that's definitely the changes that I've seen over time.
So you've really started to integrate a lot of the Eastern and Western medical concepts.
Exactly. I wanted to study medicine at a certain point, and then I decided not to. But having, done the GAMSET a few times and made a lot of friends with other medical doctors, it was enough for me to give me a point of view, where to keep studying, where to keep learning, to create that bridge. The idea of integrating Chinese medicine has already been existing in China. Probably since after the Cultural Revolution, after General Mao institutionalized Chinese medicine again. And nowadays, for instance, in China, a lot of doctors are training both Eastern and Western medicine, and there's hospitals, bigger than the hospitals we have here, that work like a hospital, but they also Chinese medicine hospitals. That's where I got the idea from, I would say. Yes.
So, what are some of the biggest wins you've had in practicing Chinese medicine? So, like, what sorts of cases have you seen turn around? And I mean, we talked a lot about chronic inflammation, chronic infection, women's health, pediatrics, mental health, all these conditions. But are there any particular cases that really stand out in your mind?
It's a few.
Obviously, you don't have to, disclose the details or anything like that. But
I can tell you there's quite a few cases. Once again, because now for the last, 5-7 years, my area has been very particular. So all these cases go around the same, very similar issues. But definitely seen people that were really, really tired. Honestly, I've seen people that cannot even speak back to you. That they just stare at you, they just fall asleep. I've seen people coming in wheelchairs, they have to be carried by their parents, siblings, or family members. And to see a person like that one day talk to you well and clear, and that you talk to them and they understand what you're saying, that they can go out, normally have walks, live a social life. That's the outstanding part. There's many cases I've seen like that. That's why, I cannot just pinpoint a case in particular. But the cases where I've seen, particular interests have been those involved tick-borne diseases, which is something that, thanks to Dr. Tanya Asha, I got very involved into. And seeing a lot of people, having particularly this area of tick-borne disease or infectious chronic infections and CFS, chronic fatigue syndrome. As far as I know, in modern medicine or in other modern approaches, they don't have a lot of answers. I was talking yesterday to another friend of mine, another integrative medical doctor, and he was telling me, I wouldn't tell you what I could do, right? People like that. So it's like seeing all these people that are really sick for a long time. They're not finding answers. A lot of people cry. I always keep these tissues right next here because tears are common here, of frustration, of desperation, right? And it's not something that you're going to see turn around in a week or 2 weeks or even a month, but give it a few months and you start seeing the difference. But when you see that face on a person saying, whoa, there is really a chance of change, that's, I think the part you could say, well, that's a breakthrough, I think in that regard, the biggest breakthrough has been for me, in terms of cases, how to make proper strategies for chronic inflammation. The theories come from both Eastern and modern Western and Eastern. But in ancient times in China, right, people were already getting fatigue and all that. But it's like as if today, it's like 10 times worse. People fall worse, you know, people get sick worse, they're way more unresponsive. So it took a couple of years at least to get, you know, these strategies work. But to see them working, you know, to see them so well worked, and I don't just give it to myself, thanks to other colleagues like my really good friend naturopath Adrian Harper. You know, we were able to put a lot of ideas together that really work, that are functional, you know. I think that's one of the biggest breakthroughs, to be able to come and say, we are driving ideas in terms of strategy. This isn't final, there's a lot of more work to do, but we feel like we got a hand on things, you know. That would be a breakthrough, definitely. Something outstanding.
So if when someone comes to see you as a patient, what would they expect from a Chinese medical practitioner, traditional Chinese practitioner?
They usually
take us through the consultation. Like, what would happen in the consultation, and then what would the treatment process involve?
be like? Well, look, our practice is when it comes to taking history, is very comprehensive, because Chinese medicine is called completely holistic practice from nature, from its root, right? So in order to make a proper assertion of what could be going on, you have to first analyze different systems, different aspects of a person, not just physical. You also need to think emotionally, mentally. That's very important. And then you have to put all that together and come up with a diagnosis. You need a lot of information in Chinese medicine, and we are very particular about how things move, right? So etiology, as in how things happen, and symptomatology, particularly progression over time, is very, very important. So usually when a patient comes, one thing is we ask a lot of questions. We're gonna ask you about questions that might not have anything to do with your condition, but for us, they're telling us about a whole picture that we need to understand, to really understand how everything is working, to make a real good, effective assertion, right? At the same time, you know, these aspects, like we do a lot of observation. Some patients notice that you're looking at them quite a lot. There's, you know, tongue diagnosis, there's pulse diagnosis. They're very foreign concepts to the modern person, right? So people, if somebody has never seen a Chinese doctor before, they're like, what do you do? I like to explain things, you know, to as much as what we know in modern terms. Part of my diagnosis also involves a lot of physical examination. So there's gonna be auscultation, there's gonna be blood pressure taking, you know, I might check your ears, I might check your eyes, checking your throat, a lot of lymphatic palpation, you know, abdominal palpation, and then also an ancient palpatory diagnostic framework, which is called channel palpation. So anything that we can use, we'll use it. Currently, you go.
What can you tell from tongue and pulse diagnosis?
You can tell a lot of things, but it's very hard to be able to tell that. For the untrained eye, it might look almost like a form of witchcraft or like some form of magic, but it actually takes a lot of time and experience of working to be able to see a tongue and say, that's a gut inflammatory problem. Or I can see the immune system is becoming hyperaggressive, or there's an immune dysfunction, or there's a high biotoxin level. You can see a lot of things in the tongue, heaps of things. Recently, you know, a case of an autoimmune disorder, you know, straight away looks in the tongue in the presentation, and you send them to get the different testing involved, and bang, you know, there's a positive reaction there. So yeah, with the pulse as well. The pulse changes really quick though. So in fact, in Japanese acupuncture, right, as far as I know, they will needle someone and they will stimulate the needles, and usually have two doctors, one doing the needling and one checking the pulse to see if when the pulse changes to stop the treatment. That's how important it can be.
I always remember the time when I was doing my medical acupuncture training, and we had this, where one of the one of the women in the course had a yellow tongue, had a yellow coating on her tongue, and they put a couple of needles in, and the coating after 10 minutes changed.
Wow.
So it was a very, very practical lesson about, well, illustrating how fast it can work, how fast acupuncture can work.
Oh yeah, definitely. The realm of Chinese medicine, you can see a lot of things that you might say, "Wow, that's a miracle." Or that happened, that was unexpected. How can it can work so well? There's no miracles in this, right? Everything makes sense. Everything has a reason, and with time, we'll be able to figure out more with science of how this works, right? But this is quite common. I've seen many times, scenarios like that. A patient might come really swollen, like you can see, I don't know, the shoulder is big or they cannot even move. And by the time they finish, it's completely the opposite. Half an hour, 20 minutes later, right? Recently, there's been some talk about in Melbourne that there's been some trials in emergency departments for acupuncture that are showing quite good results. There was a trial probably around 7 years ago, and apparently it was really good. From what I remember, one of the chief doctors in that emergency department, that was in Heidelberg, he reckoned, without making a claim, like a proper claim, that acupuncture was as effective or more effective than medications in an emergency department. For something to work that quick and well, it has to be efficient, right? And although we don't get, for instance, taught emergency medicine in Chinese medicine because nobody uses it, I've read books about it, and yeah, you hear a lot of things like that. I guess acupuncture was probably part of an emergency medicine use since prehistoric times, But yeah, that is something quite standard to see, things that you wouldn't expect. But for those that have never heard of anything like this before, it's not magic, it's not miracles, it's just the way we work. We don't understand ourselves completely. One of the magics of modern medicine is that we don't understand things totally complete well. Society keeps on advancing, so we keep on moving forward. So I'm pretty sure we'll figure out a lot of these workings in the future and how these things happen.
Yeah, fertility is another area where I think Western medicine is starting to embrace that. There's a number of IVF specialists that have, and some studies that have shown the effectiveness of acupuncture when in the area of fertility. So, I think it'll be very interesting to see what happens in the future. And how Western medicine will gradually take on more and more of the of Chinese medicine.
Definitely. Look, I think we'll be seeing more and more acceptance of it because there's a lot of research going on at the moment. There's a lot of evidence being put bit by bit. The challenge of Chinese medicine is that due to our framework means that everyone is different. So everyone is diagnosed differently. And you might get, like, let's say 4 people with migraines, but they all different diagnoses and they all get treated differently. To make scientific investigation in double-blind randomized controlled trials is quite challenging for that. However, it's taking place though. That's something they're figuring out how to do. Also with herbal medicine in that sense too. So I'll expect it to be more in use for that matter, at least in Australia. I got good news. I think the Epworth Hospital, I forgot the location, is going to be the first hospital in Australia to include Chinese medicine, including Chinese herbal medicine and acupuncture in a hospital setting.
Wow.
That's coming up soon. Yep.
Fantastic.
Yeah, it's moving quick, definitely. I know for instance, in Sweden, I think they use acupuncture in emergency departments.
Wow.
Coming from Mexico, I know in some hospitals they've used acupuncture. They've done research involved as well. There's integrated hospitals there as well where acupuncture is quite common too. So something definitely gaining momentum I would like to make just a clarification in terms of what acupuncture is and how it is delivered. For those who've never heard about this, we're currently in a time where the acupuncture title is being used in many different senses. So I want to explain there's different ways you can call acupuncture. I guess the only true acupuncture methods we have at the moment are the Chinese medicine system and the medical acupuncture framework. What we have at the moment is other practices, you know, claiming to do acupuncture, where they're not training acupuncture, they're not acupuncturists. The acupuncturist title in Australia is protected, but not acupuncture, which is a bit of a funny thing. So for those who have never had acupuncture, make sure you ask your practitioner, what's your background? What do you study? If you're doing medical acupuncture, you have to be a medical doctor. You have to have a minimum training to do it. If you're a Chinese medicine practitioner doing acupuncture, you have to have a Chinese medicine bachelor's degree. I know a lot of practices are claiming to do acupuncture, you know, and just be mindful that you might be getting something else thinking it is acupuncture. Just for those of you that are new to this, just ask. Oh, you know, ask questions, ask questions. If somebody doesn't want to answer your questions, then be very suspicious about that person. Maybe look for another practitioner. Any good practice will always be honest and open with you.
Very good. Now, I just wanted to talk a little bit about, you know, things like moxibustion and cupping, gua sha, those sorts of techniques that you use. Just give us a little bit of a rundown as to what they are and what sort of things would be they would be used for.
They'll be used for. Well, look, when we say acupuncture, we're talking about a broad system that includes different practices to stimulate pressure points. When we hear acupuncture, we think about a thin needle going through the skin, right? But that's not the case. In fact, acupuncture in Chinese medicine is not called acupuncture, it's called Jingluo, which means channels and vessels. And what it talks about is a theory where we are divided in a concept that we call channels and meridians. We're starting to understand it has a lot to do with fascial planes now, it has a lot to do with electrical conductivity. And along these channels, meridians, there's the so-called pressure points or acupoints. Without going into too much detail, you know, there's a lot of different ways they work. There's different sequences they work through. This is a whole organizing system, which from what I know, we're starting to believe it has to do with the way the body organizes, it is formed. By the end of the interview, I'll recommend a book to you guys from a great medical doctor writing about this. But when it comes to acupuncture, it's about how you stimulate pressure points. You can needle them, you know, you can bleed them. Back in thousands of years ago, they didn't have those thin needles. They were only like in the last few hundred years. They grab bones, they'll have rocks and prick people and bleed them out. When the metallurgic times came into China, you know, they used to use like big needles, you know, for bleeding as well. To put in needles and leave them in people is a very recent thing. So what people were doing then, we're figuring out how can we stimulate points? So they realized we can apply heat to them, we can apply cold to them, we can stimulate them. And then they realized there's different ways to stimulate. That's how Chinese massage came, which as far as I know, I understand is the mother of all massage, including remedial massage, which comes from Swedish massage. That all comes from original Tui Da or Chinese medical massage, right? So somewhere along the way, they also realized that cupping can be applied. I don't know where cupping comes from originally. I know it's been used in many parts of the world, including the Americas, for a long, long time.
So moxibustion is where you heat the needle, right?
Yeah.
And then cupping is where you use suction.
Suction cup. Yep.
Yeah, create a vacuum on the skin.
Yes. Moxibustion, you can use any form of heat really. Even in emergency scenarios, if you are in the middle of the bush and you need to do moxibustion, you're a Chinese doctor, you can use a cigarette. You know, you can make a fire and grab a piece of coal and place it close to a point. It's all about really knowing which points to use and how to stimulate them. It's the same with cupping. They all have different effects. We're still understanding the effects of cupping in modern view. The effect of the circulatory changes due to the pressure pooling that you might get. I know that ice, for instance, has been used, applying ice to different points to cool people down. Washa, I don't know if you guys heard of it. It's also called the scraping technique. And it's a technique where we usually use spoon. We also call it spooning, but that's a really bad name for it, like a ceramic spoon. And then we scrape a particular region to create a bruise. I remember reading, there's an integrated Chinese medicine, Western medicine hospital in Germany, in Essen, right? In Essen Medical University. And they made a research on washa, and they found that the bruising created by washa forces the body to mediate inflammation through a hormonal pathway, through the endocrine system, and that's going to affect the whole body, right? So for instance, back in the day, like you get somebody with severe fever, very hot, you know, with a lot of pain, gastritis issue, and you'll give them washa, you know, and within half an hour, 1 hour, they'll start to get better. And the Chinese will say that clears heat. Now we know, yeah, heat is synonymous to inflammation. Now we know why, right? So there's definitely different ways to apply therapy to a person through the Jinglo concept. I can tell you a story. Once, very quick. Once my mom went to hospital. She had a dysentery. She had this really bad diarrhea. I finished practice. I went to the hospital. She was still waiting in the waiting department, and she had a massive fever, right? So I gave her twina, and I pretty much grabbed this part of the forearm, and it's called the rapid pinching technique. So I just went in each arm. Within 5 minutes, the whole temperature dropped. Her face came back. And she started going like, what do you do to me? And I'm like, it's just Chinese medicine, you know. When the doctor came to check her, he's like, what happened? You had all this fever before. Now you're looking a lot better. It's just the way you can do the application for these points, you know. Pressure, moxibustion, cupping, bleeding, needles.
So what would you use moxibustion, in which sort of situation would you use moxibustion and cupping?
You can use moxibustion to stimulate the action of a point. This is along particularly the points that will relate to stimulating immune function or stimulating digestive function. That's where it'll be the most effective. For instance, there's points that if you have diarrhea, you can stimulate certain points in the front of your legs and certain points in your abdomen just with heat. You know, you have to know how to do it. It's not like you apply 5 seconds of heat and that's it. You need to know how long the reactions, how to see them, right? It's not easy, right? But if you know how to do it, just with that, you can make an impact. And I've seen it before, especially working with kids. I don't like to needle kids. I needle, you know, more teenagers, 15 years old upwards, because they're scared of needles and they move. It's dangerous for me, it's dangerous for them. So usually techniques like moxa will come in play where you can move around easier, or cupping or twina, right? Interestingly enough, I tell you a funny technique in moxibustion. If you see somebody really warm, even having fever, you can actually bring the fever down by warming certain points in the particular and the lower region. I learned this technique back from an ancient practitioner called Li Dongjuan 800 years ago, and he said, if you see someone really hot, like feverish, that's why they said a yang expanding reaction, floating yang. But he says the true yang is in the abdomen, like the real vitality. So if you stimulate it, it's going to grab all these yang, like this is abstract knowledge, right, and bring it inwards. That I've seen it happening all the time. I see a patient really warm, like feverish or moxa there. Within 5 minutes, the hands are freezing. Like I've seen that so many times. Cupping, you can do it a lot to stimulate circulation, and you can do it a lot for pain. But you can do it for many issues as well. I have worked with chronic bloating reactions with cupping quite well, cupping and moxibustion in the abdomen. And you don't even need to do acupuncture. You can just warm and well, get the cupping, get it to move, and within a few hours, the bloating starts to come down. just by affecting a circulatory function in the body. Cupping goes to different levels because it gets applied in different ways. It's for many purposes. But the most particular aspect we're using it for nowadays is for pain, definitely. And it's a very effective practice for it. And as far as I know, it's quite safe. I haven't heard of any issues, aggravations from cupping. You're going to get bruising, which is coming with cupping, and it's going to take around a week or two to go away. And that's normal. It's a normal reaction with it. So yeah, I guess you could say they different kinds of applications we can do.
Fantastic.
Actually, before I forget, just one more. Cupping, when I used to work in psychiatric centers, cupping is awesome to sedate a person coming from an acute anxiety attack.
All right.
Somebody going, crazy, like what's going on, like they get really feverish as well, and they start to sweat. You cannot needle them either because they're gonna move. Cup them, particularly in the back. Know your points where they cup. Leave them there for 15, 20 minutes. They come freezing. They come falling asleep after, as if you're giving them a really strong sedative.
We've talked a bit about how traditional Chinese medicine is, it's more holistic, and it's got a very good holistic concept of health. How would you define, or could you define health from a traditional Chinese medicine
point of view?
Viewpoint? I mean, is there an overall definition of what health is in traditional Chinese medicine?
I guess the definition I could think of is the definition of balance and harmony.
Is what, sorry?
Of balance and harmony. In the Huang Di Neijing, the Yellow Emperor's Classic of Chinese Medicine, on the first chapter, he talks about that. I guess their aim was to explain that the most important aspect we need to follow is to have a balance within ourselves. They understood that we're not perfect and people have dysfunctions. We don't have the perfect bodies. We're still evolving beings. Our minds are still evolving. We're still evolving emotionally. We're changing physically. I'm not sure to what degree, but definitely at least on an intellectual level, we're moving quite quickly, right? These people understood that we change, that we move, that times change. So what they say wasn't about you have to be like everyone has to be in a particular stance, in a particular line, right? They say variations, randomness is the order of universe. They understood entropy, you could say, right, and say it exists amongst human beings. So they said every human being has a balance ingrained within its own framework that is unique to that person. And I guess that's the definition of well-being, that a person needs to be in balance with his mind, with his emotions, with his physical body, and that means a lot. The way you eat, the way you rest, the way you feel about the world, the way you see yourself, the way you connect to other people, your idea of the world itself, your idea of balance. Interestingly enough, if you ask somebody in the modern times what balance is, you might get them thinking it might be something they haven't really thought of properly. But for them, this was the main concept of it. And the rationale comes from, according to the ancient Chinese that wrote these ancient texts, it was people that were ancient to them that invented Chinese medicine. As far as I know, we don't know who invented it really. But they said there were people that live in way times older than them. And there were people that learned how to live with the universe, that learned how to be in balance with night and day, with the seasons, that learned how to look after their bodies in cold and heat, that learned how to adapt, how to go with the things. This is big part of the concept of Taoism. I'm not going to go into play with it. If somebody wants to know, you can just go on internet, look for what Taoism means. But that's what it is about. It's about the way of things and how you move with the world. It's like what Bruce Lee said, right? Be like water,
Hmm.
flow with things. That's what we're supposed to do, flow with the universe and have a balance with it, a harmony,
Hmm.
be able to adapt, to be flexible. That was their idea of balance and well-being, definitely.
That's something that's definitely missing in modern society. We don't have
I
any
think so.
concept of flowing. We don't have any concept of, seasons.
Mm.
That whole sort of cyclical change. We don't. We've kind of lost sight of that, and I think we need to get a hold of that more. Which is why I think, traditional Chinese medicine is so relevant in so many ways. Um, we've got a few minutes left, Oscar, and I just thought last couple of questions. One question I wanted to ask was if you were to talk to the Oscar that was coming out of traditional Chinese medicine school, are there any regrets, any things that you would say to him now that you should watch out for, that you wish you'd done, or something like that?
I never asked myself that question before. You caught me off guard. Um, what could I say to myself? I would have said, I guess, study harder. I've studied, I've done my level of study, but if I go back, to the beginning, I feel that I could have done even more study within my practice. Um, I'm probably more brave with things. When you come out of a Chinese medicine doctor, it's not a practice like modern medicine so well accepted yet, and you're still seen as a witch doctor. But you usually encounter from day one really chronic complex problems that are very hard to deal with, and sometimes they can be intimidating. Sometimes, especially on your first year, you can get intimidated. You can feel inferior to other practices. You can feel overwhelmed with the amount of knowledge you have to manage, with the amount of responsibility you have to manage, especially if you're on your own, right? So I would say, if I was gonna talk to that Oscar, I would say just be brave. I feel I was brave, but I feel I could have been more brave. Um, keep the image of your medicine strong. Don't let people come and tell you this or the other unless they really know. Be very mindful who you're gonna take a comment from Chinese medicine, because everyone has an opinion, right? But who really has a valid opinion on this? Who really knows about this? So I would, tell that to myself. Be more in balance with the way you you look at things. And yeah, just maybe could study a bit more in some cases. Yeah, that's what I would say. I think all in all, I deal with it well because you have to have a lot of balls. Sorry to say it like that, but because you're really confronted with a lot from day one, and that goes for all of you guys that are about to finish your degree, hit the professional world. The first year is hard, trust me, and that makes some breaks. And as far as I know, most practitioners don't make it. Don't give up. Just don't give up. Keep going. It's gonna get better. You'll learn how to do things. You'll get a point where you'll be comfortable, with what you do, and then you start to grow and grow and grow more and more.
What would you like to see happen in the next 5 years, Oscar, in your practice?
I would like to see more acceptance from the general public to what we're doing. I would like to see more people saying, I'm going to go and see the Chinese doctor. I would like to see more people saying, I have this issue. I think the Chinese doctor can help me, give me some advice. Even now, working in chronic fatigue, the standard is a lot of people will go into modern medicine, and then they will scratch other practices. So sometimes it's very hard to work with people because they don't want to go into treatment that you want to do. They want to have simple things, but something very complex. And I actually have to tell them, this is if you want me to help you, this is it. If everything else, I'm just gonna, it's not gonna yield results, right? So that's what I like to see, that people understand more what we do, that people are more aware that we're here, that we have a lot of value. I know there's a lot of work to be done to show also the world what can we do, to go beyond the chi and blood yin and yang ideas that nobody else except for us understand, and really expect it in layman terms. And one dream I personally hold, this isn't my dream I chose, but I read it once from another practitioner. One day when a little kid, in primary school, his friends asked him, what do you want to do when you're old? I want to be a Chinese medicine doctor, That's something I would like to see even in the next 5 years or in the future, that we are given the credit that we truly deserve. Definitely. And I'm pretty sure that's going to happen. We're working on that. That's something I can tell you.
I think that's probably material for another interview, like if we can sort of maybe explore some of the Chinese medicine concepts in layman's terms, that concept of qi and blood yin and yang that you were talking about. I think that would be excellent.
I'm happy to answer any questions.
Yeah, last question, Oscar. So are there any questions you think I've missed out on? Are there anything more that you would like to say?
I think you're a very good interviewer. You asked me the right questions, I can tell you that. So thank you very much for that, and thank you so much for taking this time to answer me, to allow me the opportunity to bring this to the world, right? My final thought about this would be, this is to the world. The world's changing, and we're seeing a huge incidence in chronic health. The amount of chronic issues, including chronic pain, chronic mental health problems, chronic fatigue syndrome, chronic everything, right, is starting to increase. And this is going in hand with the human being becoming more and more disconnected from the world. We're a lot more connected to these devices than we were a tree nowadays, than we were our neighbors, right? You're in a tram or a train and everyone is in that little box, but nobody says hello to each other anymore. We have to be aware that we are on responsibility as human beings, and our race right now is in our responsibility, I want to tell everyone out there that has a chronic problem that maybe practice has told you, oh, there's no cure for this. There are other options around. Look around. At least for the people in Australia, Chinese medicine is a regulated practice under APRA. So to practice Chinese medicine, you need a bachelor's degree in Chinese medicine. You get treated like a medical doctor. You have to do certain education every year, have insurance, have a certain level of education. So here, if you see Chinese medicine practitioner, you guarantee they have a standard. Australia is the most advanced country in Chinese medicine in the Western world, in both practice and education. So we are the pair with China. That's what I mean before. If you're gonna get acupuncture, ask them, what's your modality? Are you Chinese medicine practitioner? Are you a medical doctor? Make sure people that you know what you're getting into. Ask questions, and once again, we come from a point where balance is priority in our practice. Harmony is priority, and we treat from that point of view. For us, what we're after is to help the body achieve the balance it needs in between different systems, between different functions, to work himself out of an issue, because we're made to heal ourselves. When we get complicated with a chronic issue, it's usually chronic inflammatory problems involved, and it has a lot of different aspects involved. So what we do is helping, your body, your mind, thoughts to work aligned again. I will also, do direct treatment, like symptomatic treatment or for certain aspects, but we both work in both ways, with the symptoms and with the root of the problem. So once again, those who have had a long-term chronic problem without response or resolution, I'm here myself. I have worked with all that throughout the years, and I have a lot of colleagues in Melbourne and in Australia that are really good, that you can go and see, or you can look in the directory on the internet. look for a Chinese medicine doctor. We heaps around at the moment, you know, especially in Melbourne. I'd like to finish with one more thing. I want to tell you guys that for all of you guys that have been saying, how do we know this thing works? Or that's so airy-fairy juju, right? There's been a really cool guy, a really admirable person that has wrote a book in bridging the Western with the Eastern. And for the first time in human history, in my opinion, somebody comes with really good work and gives it a rational sense, a tangible sense that says, yeah, this is what it is, you know, and puts the Eastern, the ancient classical with the modern, right? Let me see if I can just find the picture of the book and I'll show it in the camera. The name of the book is The Spark in the Machine, for those who have never read it. And it's written, just looking for the, for the picture of the book so you guys can see what it looks like. It's written by a British emergency physician called Dr. Daniel Kuhn. And if you can hear me there, Dr. Daniel, thank you so much for your work. And his work is about what does this mean in Western terms. My biggest respects for this work. This is amazing. This is groundbreaking work. I don't know if you guys can see that.
Yes, I
That's
can.
what it looks like. The
Yep.
Spark in the Machine.
Spark in the Machine.
Yep, by Dr. Daniel Kuhn. This book is written for the public, for anyone that is interested to know. So anyone that reads this and gets a bit curious of what's this guy talking about, go and read that book. It's going to give you the explanation you're looking for.
Well, thanks very much for your time, Oscar. That's been fantastic. It's been a wonderful time. We'll have to do it again, flesh out some more. Yeah, some more concepts. Would love to hear what everyone thinks in the comments section below. Click the like button, smash the notifications bell, the subscribe button, and we will catch you in the Merge Health audience. We'll catch you in the next interview. Thanks, Oscar.
I really just want to say thank you very much, Wes. I really appreciate the interview. I really appreciate you taking your time. And thank you so much for this opportunity. And thanks to everyone that has been watching and listening this video. And I really hope to be here again, talking more about these ancient concepts.
We will do it again. Definitely do it again.
Perfect, perfect. Looking forward for that.
All right, Oscar. Thank you.
No worries. I'll catch you next time. Thank you so much, everyone. Cheers. Thanks, Wes.
Bye.
Bye-bye.